Okay. Hello everyone, welcome to another episode of TooHealthTalk, a show where we talk about real health challenges, health conversation, and get to break it down in a very simple and honest way. On today's episode, we have a very special guest, Dr. Abdulrahman. Welcome, Doctor.
Thank you for having me. Thank you.
You're welcome. So today we have want to have a very honest conversation on everything about you being a doctor, every challenges a
Sure.
young doctor has ever faced.
Okay.
Um,
Okay.
you know, so I know you're a very young and promising doctor. I've worked with you in some areas, and I'm like, oh, yeah, one of
Appreciate
like
it.
the real G's. So what was it like being a doctor?
Being a doctor in Nigeria is one of the most stressful jobs you can ever have, in all honesty, because it's it's very difficult when you're juggling a lot of things. One, you have to study to even become a doctor. Two, you have to continue studying after becoming a doctor, which is stressful enough. Three, there's so much interior hospital politics that you have to really maneuver because you don't want to upset your immediate boss, but your immediate boss has to look good for his boss to approve him, and it's a whole mess, including and especially the whole working hours. We're talking about 30, 32 hours of non-stop work. As long
Or
as patients are coming, you have to treat,
or
regardless. So if you're not really careful, you can end up going from treating patients to becoming a patient easily, easily.
I was thinking that if you work a lot of hours now you get more money now.
Yeah, no, it doesn't. They don't do that over here. It doesn't work that way. It doesn't work that way. It's a flat rate. You get paid. I'll see you tomorrow. Business as usual, Monday to Friday, with call, without call. If you're unlucky, weekends. If you're also very unlucky, extension on top
Wow.
as a
So
punishment.
so so I've seen that video. There's this video on TikTok. And this is that they said that this is say um this kind of motto civil servant no fit afford them. Have you
My
seen
brother,
that? My brother,
yeah,
yeah. Yeah. So
thank you, Mocha.
yeah.
Yes,
So what about doctors?
including and especially doctors.
Whoa.
Yeah, it's a fact. Yeah. Most doctors are basically one disease away from poverty. As
Sorry.
it's no, you laugh, but it's unfiltered. It's the raw truth. Like a very serious disease. I'm talking about
Wow.
a major surgery. Ah, no.
So what's the glory of becoming a doctor?
Oh, it has more to do with the prestige. Also, yes, but I mean, back in my personal opinion, doctors are more glorified back then compared to now because almost every patient you see now has gone to Google School of Medicine before coming to you. So that's challenge number one. So you have to balance the knowledge you have gained versus a rumor or hearsay. Because I almost always tell my friends, Google will tell you that you died yesterday and you're here today. So judge yourself. That's the problem. And the pay is horrible. The working hours are also horrible. In fact, something is going on currently right now in Kaduna Teaching Hospital, where some doctors, training doctors in training
Oh,
for consultancy, they were on strike for a few days, and when they came back, the management board um, fired them
wow.
and they asked them to pay 50% of their salary for the past 6 months.
Wow.
So the big trouble, big trouble.
Interesting. So what's the misconception about doctors around the world and in Nigeria?
I mean, people think doctors don't get sick. It's a it's
Me, I think so too. Doctor, why you sick?
like
Like,
why?
my friends are doctor like, you're
Yeah,
sick.
and people get surprised. I mean, that's one problem. That's one misconception. Doctors don't get sick. Or how are you that sick? Don't you know what's going on with your body? And I'm like, okay, wait. It's not that simple. That's the first misconception. Second misconception, people believe, this is my personal opinion, people put doctors in one box, right? And there's more to life than being a doctor. Yes, of course, saving life, being good to people was also good. But when you put me in a box, it's very difficult for me to live my life outside the box, right? So let's say I go to the market and by some incidents, I see a patient and they're like, Doctor, doctor, how are you? Suddenly people start treating you differently. And it's like they remember they're not feeling fine. That doesn't make sense.
True.
It doesn't make sense. So those yeah.
So
Those are the major
also
ones.
I've also heard about like people don't like when young doctors treat
Very
them.
true, including and especially Nigeria, because it's this the problem we have is yes, of course, you're old.
Why?
The older you get, the more accustomed you become to your own habit or practices. So if I spend 10, 20 years prescribing paracetamol, and somebody comes and tells me has ibuprofen, it works just as good as paracetamol. I will I will look at him funny because I'm already used to it. Now imagine that analogy, but in terms of a professor and someone who recently graduated from med school. Yes, of course, the professor he's probably tired out. He doesn't have any passion, and the passion has gone. But for the house officer, he's still fresh. And what you want is someone who's fresh, so he can make things happen and move. It's just like imagine a doctor, a full-fledged practicing doctor with the backing of GPT versus a professor with the backing of his own individual knowledge or his brain. GPT will win every day,
Oh,
regardless of age or level.
talking about GPT, like the new revolution of like technology, health tech, like what is this impact of like health tech in the current medical like industry?
We're cooked, we're done. AI is coming for us. Even our jobs were done. In short, that's basically what it means. I saw a TikTok 2 weeks ago of someone who spent 12 years learning how to read, how to interpret an X-ray for cancer patients. That's his specialty. He spent 4 years pre-med school, 4 years med school, 4 to 6 years specialization in his own craft, specializing in his own craft, and AI took his job in 12 minutes because
Wow.
AI was just as good or even better at him in diagnosing diseases, and AI did it in 5, 10 minutes. He spent 12 years. So I think the solution is to empower doctors, specialists with the technology of today. It will make things better. Yeah. Well, with professors, with ageism, like you said, the younger you are, the more accepting you are of of technology. The more you grow, the more stubborn you become in your own ways. And
Wow.
it may be good, but the bad part has more. There's more bad than good, in my opinion.
So for talking about like your professors and the rest, which specialty like do you think like have like more issues? Like if you are going to talk about like five specialties now, like, what's your take? What's your biased view, or I mean your unbiased view about each specialties?
One, pediatrics is horrible. Pediatrics is bad, 100% bad.
How?
Because pediatrics, you're not only the doctor, you're the counselor because you need to inform the mother. You do. We've seen cases where newly born mothers, put engine oil on the baby's forehead.
Wow.
Yes.
Engine oil.
Correct. Engine oil for car. Vroom, vroom, on head. Yeah. So they put engine oil on the head because they don't want the head to expand, and that's the whole problem on itself. And we always ask them, "Who told you?" They always quote someone from the saloon or from the market. It's never a doctor or a medical professional. So you have to be a counselor, and you just hope the baby doesn't die. And because with pediatrics, you're dealing with an innocent patient, right? It's a 4 5 year old. The baby, a 4 5 5 year old does not know if smoking is good or bad. It just knows somebody smoking. He or she may or may not enjoy it. If he comes into contact with a cigarette, he or she will enjoy the cigarette or experiment. So it's very difficult. So yeah, you're fighting, you're battling a patient, you're really counseling the mother, and if you're unlucky, you see a father who doesn't know anything. Problem, because The best they can do is let me call the mother. She knows more. That's the
Wow.
best they can do. So yeah, that's pediatrics.
So for another, do you have any else specialties that?
Internal medicine is a lot because you need literally internal medicine. You need to handle everything that's found inside internally. So the way I see it is you will learn 100% everything, and maybe after a few years, you will end up practicing or using maybe 20 to 30% of what you learned. But you
Oh,
don't know the 20, 30%, so you need to know the 100%. So it's like a semi scam. Yeah, that's what I think. And yeah, surgery is the best.
oh, so surgery is the best.
Surgery is the best. Surgery is the best.
All right.
Cut, cut the skin, cut what needs to be cut, close, simple, rinse and repeat. And you just get better at doing it. If you have the legs, you need really good legs because stamina is important, or else
Oh,
you're
true.
going to retire early. But surgery is chill. It's simple, documentation excellent, practice even better. The people have good energy. Pediatrics, that's where people just that's where angry people go. Pediatrics, that's where angry people go. Yeah. I mean,
So,
yeah.
so what are the money aspects?
Money
Surgery.
aspect, people. Okay, this is my own personal opinion. People say follow your passion, or passion has never paid rent.
Yeah, sure.
So I believe follow what you're good at, or what you think you're good at, or what you think you can be great at. So I would go for passion wise general surgery. Surgery all day, every day. Boom. Smart investments, general surgery, you go. Because I don't want a situation where you're making a lot of money, but you have the stress from the job is taking the quality of your life away. You don't want a 40-year-old pediatrician who's always angry and he has hypertension and diabetes and he's dealing with so much stress at home in the office, he's taking a back at home and the wife isn't happy, the children are scared of daddy, it's a whole mess. So follow your passion, monetize it, boom. Don't follow your passion, sorry. Follow the money, make more money, monetize it, retire.
I mean, I was not thinking that pediatrics might be more chill because they handle children. You know, they
Yeah, no,
play
children are crazy.
their office are like
Yeah,
shiny,
scam,
shiny.
scam, it's all scam. Children are crazy, and one of the problems which I've heard and seen everybody complain about is the calculation of dosage for medication. It's annoying. It's okay, but it's annoying. It's understandable, but it's annoying because you have a situation where you have a 1-year-old weighing 5 kg, and you have a 10-year-old weighing also 15 kg. Now, you can give them the same medication, but it can never ever be the same dosage because different babies, different weights, different needs. So, you being a pediatrician, you're also a part-time mathematician. Sorry, so you're a counselor, medical practitioner, mathematician, all in one. So it's a lot. It's yeah.
Thank you. This episode is actually one of the liveliest and funniest episode I've ever
Thank you.
posted. Thank you so much, Doctor,
No
for
problem. Thank you
coming
for
on the
having me.
show. I would love to have you again.
No problem.
So please, if you want to support what we're doing here, if you want to see more of our doctors come on board, please support us by subscribing, like, share, and comment, and see you in the next episode. Bye.